Today we went over a number of topics. First of all, in terms of communication, how we should work with the communities to make them more aware of meningitis, how to work with patient groups so that their voice will be heard, and also how to work with survivors. This is some part of the problem that is ignored. 20 to 30% of meningitis patients, meningitis survivors, have sequelae in terms of impaired vision, in terms of deafness, but people don't think about them. So they have to be also organized so that their voice can be heard, so that we can take care of them. Globally, for us in Africa, really what we expect from 2030 from this meeting, and for what the Wilton Park and the Meningitis Research Foundation and all the other partners should do, is that from now to 2030, to have a point of care, good quality treatment, good laboratory diagnostic, so that we don't have to take cerebrospinal fluid and send it to reference laboratory. There are mobile laboratories which are available, the technology is available, and we think that from now to 2030, the molecular diagnostics can be available, so that at the point of care we can have the CSF taken and the laboratory diagnostic done for the confirmation of the serogroup. The meningitis issue should be a global issue. There are gaps that we need to bridge, so that we have a global surveillance of meningitis. We have strains in the UK, strains in the US, strains in Europe, strains in Africa. The major burden of meningitis disease is in Africa, but it's a global issue. We do more advocacy with donors to fund manufacturers, and manufacturers to manufacture or to develop more and more multivalent vaccines, so that we can encompass many of the serogroups, taking them as one into routine immunization or into vaccination, so that we can by 2030 eliminate meningitis epidemics in the world, and particularly in Africa. We have world-renowned experts here, and they have discussed in plenary and in group works. Everybody have a common understanding of the issue, and everybody agree that meningitis should be taken high in the agenda of the world public health. We are having every year a meningitis annual meeting. Why not have a big event in 2030? Vaccination has shown that we can defeat meningitis. In the UK, we've defeated Men C. In Africa, we've defeated Men A. And we are in the process of developing a pentavalent conjugate vaccine, Men A, C, W, X, and Y. And we think with that, it's possible to defeat meningitis. I'm really optimistic.